Hello guys, once again DangTeach at CCSD. Let's continue on our discussion. So in part 1 we talk about the reasons for compounding and we started getting into beyond use dating and some of the equipment. So in part 2 we'll continue on, talk a little bit more about the equipment. And we'll get into some of the procedures on mixing different dosage forms. TC versus TD. So a very important concept, to contain and to deliver. So to contain means that's it. That's all it's going to contain. It's good for one amount, one volume, and that's it. Whereas to deliver is designed to administer or dispense the appropriate amount. So it's going to hold a little bit more, and make sure you know not to empty. Try to empty every single drop out of a piece that's designed to deliver. Alright, so our first piece of glassware, volumetric flasks. So they're a one-trick pony. They only measure one volume. That's it. So if you go up to this line, that's 5 mLs. If you go to that line, that might be 10. That line, 50 mLs, 100 mLs. Go to that line, 250. And that's it. It's good for if you want an exact volume. Graduated cylinders are designed to deliver. So there's going to be a little bit left over. So for this one, you're going to draw it up with a suction bulb. And then as you release the pressure, you'll measure, I delivered 1 ml, I delivered 2 mLs, I delivered 3 mLs. Cylinders. So we have the conical, so they're just cone shaped, and or the graduated cylinders. So for these items, they're both designed to deliver. So there might be a little bit left over here in the pipette, and there might be some clinging to the sides after you pour it, but they're designed that way. Syringes are designed to deliver. So definitely oral syringes in the tip, there'll be some remaining. And even in the IV syringes, there'll be some remaining. So don't pull back on the plunger and then try to blow out every last drop. You would then administer a little bit too much. When measuring with a graduated cylinder, most of the fluids will cling to the sides and create a meniscus. So it's a moon shape, and to read accurately, you want to read at the bottom of the meniscus. So here at eye level, make sure you read the bottom. If you read from a different level, then it might register it incorrectly. Single volume pipettes or calibrated pipettes, they're designed to deliver. So if you have something really thick or resistant to flow, you may have to hold it there for 3 minutes. So don't shake it. Don't try to wiggle out that last drop. Just let gravity pull it down and it will deliver the correct amount. I like using syringes to measure because after you're done measuring, you can just throw it out. For glassware, you'll have to clean it. And it takes a while for anything super thick to flow down the side. So you might get a bunch of bubbles that form. So using a syringe makes it a lot easier. Mixing powders, you want to use geometric dilution. So if you have a lot of white powder and very little of this yellow powder, for instance, you want to blend them evenly. But if you just throw them in together, you might get patches of white powder or patches of the yellow. So you want to start off with equal amounts, blend that well, And then what you want to do is then add equal amounts of the white powder. So here's the blended first portion. Add some of this white, equal amounts, and you repeat until it's fully blended. Spatulation, that's just using the spatula to help pulverize. You may have to do it inside a bag if it's a eutectic powder. So all that means is something that sublimates. So like mothballs, they're solids, but they go into a gas directly. So there's no liquid. So you never see any liquid mothballs. Right? So things like camphor, if you just pulverize out in the open, it may just evaporate away. So you can crush it or mix it inside a bag to prevent it from sublimating. Ointment slabs. So to use an ointment slab, put your ingredients towards the outer edge of the ointment slab, and you want to just introduce a little bit of each at a time. Blend that well, and you're using the same principle as geometric dilution. So once the first portion is blended, you're going to add a little bit more of each ingredient, blend that, and repeat, just like geometric dilution until it's all incorporated. Levigation. So titration is using more impasto. Levigation, you're going to use a solvent. So this is the oil and water or water and oil method. So two things that usually don't mix, you may need to heat it up to get it to mix, or you might use levigation. Aqueous solution. So that is water as the solvent. If it's not miscible in water, you may need to titrate it before adding it into the water. Making syrups, thicken it with usually sugar. However, if sugar is not an option, you can thicken it with methylcellulose. So this is similar to paper pulp, and it'll thicken up the solution. If it's not water, then it's non-aqueous solvent. That could be alcohol or anything fatty. So oleogenous is fatty, and a colloid is like a suspension, but you still have little solid particles mixed in. For making suspensions, you might add an electrolyte to prevent the solids from clumping together. So positives and negatives charges will attract. So what you can do is try to make everything positive charged, so then they'd repel each other and stay in solution longer, or conversely make everything negative charged so they repel each other. You can add a thickening agent like methylcellulose or sugar, and always affix that shake well sticker. Flavoring helps unmask the taste of a drug, and you can use different types of sweeteners like peppermint, cherry. Coloring is for the psychological factor. If you give something that's clearless to a patient, they might think it's not going to help them, but if it's bright red, bright orange, bright green, then they might think it's a lot more potent. Emulsion, oil and water. They normally don't mix, but you can trick them into mixing by adding an emulsifying agent. So this goes along with that salad dressing analogy where your olive oil and the vinegar separates. So you can add something that is a little bit oily and a little bit water, like egg yolk. So that's the emulsifying agent for salad dressing. Here you can use the gum method. So either you're adding oil in the water base or water in the oil base, but you're just getting it started. You're just getting it to mix, and then you're going to add it into the remaining amount. And the goal is to get a dispersion. Little droplets of oil within the water or little droplets of water within the oil. Many different ointments we can make, like diaper rash protectant. We can add antibiotics. We can add fever reducing compounds or things to break down skin. If you have a lot of scar tissue, that will help promote sloughing off of that dead skin. Suppositories. So for rectum or vaginal insertion, they're bullet shape. They can be water-based, so gelatin, or they can be fat-based. Cocoa butter is a common one. So you'll heat these items up, mix in the drug ingredient, and then pour them into molds. Here are examples of some aluminum molds and some disposable plastic molds. Very important that you let them cool slowly. If you put them in the fridge right away, they'll shrink rapidly and they'll cause voids within the suppository. So let them cool down to room temperature first before putting them in the fridge to finish them off. Capsules made out of gelatin, so they'll dissolve in water but won't dissolve in oil. They'll come in many sizes, so inverse relationship, just like needles, so the smaller the number. So this is like a triple aught, and then the 5 is really, really small. We can use a machine to fill capsules, or we can use the punch method. So make a pile of the powder, and you'll separate the capsules. And just using the larger end, repeatedly punch it into the powder, compacting it within the large end. And then you'll just cap it with the small end until it snaps shut. And using the punch method will prevent contamination with any lubricants or anything from the machines. All right, that ends compounding. So once again, thank you for joining us. We don't have too many lectures left. It looks like we only got 4 more lectures to go. I'm going to cover retail pharmacy and hospital pharmacy, and that'll be it for phase 1 of Education 4.0. Once again, thank you for joining me, and you guys have a good day.